Hi, everybody. Welcome to the Let's Get Real program tonight with Coach Menachem Bernfeld and our special guest, Dr. Jacob Freedman, all the way from Eretz Yisrael, bright and early. Boker Tov, thank you for coming. Again, tonight is Shir 115. Dr. Freedman has been in once before, but we're holding by 115 now. Ken Yerbu, and we have a lot to discuss tonight, so let's get through our formalities over here. Again, anybody who's joining us, we always like to start with thanking everybody for coming every week and for promoting it and telling people about it and posting on your WhatsApp statuses and telling family, friends. And it's really grown tremendously, all naturally from people telling each other. So we appreciate that. As we call it a sichas chaverim, to really clarify issues and really grow together. So thank you for that. And again, if anybody wants to join, get every Sunday the flyer from me directly. You can WhatsApp me personally at 848-525-0066. Again, that's 848-525-0066. You can go to menachembernfeld.com. You can sign up on his website to get the emails of who's coming on. He sends out the recordings. And then if anybody's watching this later on YouTube, you can click on the like button, the subscribe button. So Menachem uploads the shir. You could watch it live when it comes out. And it could be mahana everybody. Always start off thanking the advertising sponsors for promoting us on all the advertising channels. First, thank you to the Liquid Scoop here in Lakewood for promoting us on the Liquid Scoop. Rabbi and Yaniv from Kazakh.org. Ellie and Ariel from 5 Town Central for promoting us over there. And special thank you to Chayla Kaufman and Shmuel Sam from JCN, the Jewish Content Network, for always promoting us across all the digital platforms. I remember, Dr. Jacob, when you came on last time, I was very high at fever and I was reading very quickly. I'm going to try to go super slow now, because I remember last time you said, wow, that was quick. Again, if anybody was here the first time, every Sunday night at 9:30 on this Zoom ID, we have different topics, different shiurim, different rabbonim, different therapists. And we have everybody, so really appreciate it. And Dr. Jacob is the biggest. We appreciate him agreeing to come back again. Next Sunday, we're going to have September 11th. It's funny because I think last time worked out the same way also. Both from the Bishlocha magazine. Dr. Jacob Freedman, next week is Yosef and Shushan. And then Erev Rosh Hashanah, the Sunday before, Rosh Hashanah Sunday night. So not that Sunday night, the Sunday before. We're going to have Rabbi Uri Deutsch, world famous over here in Lakewood, Big the Gadol. So he's going to be coming on giving us our Rosh Hashanah motivation. The next week, it's Rabbi Yosef and Shushan. He's a motivational speaker, a teacher. He works with a lot of teenagers in Cleveland. He also writes in the Mishpacha magazine. The title of the shir next week is called "A Call to Action: Why We Desperately Need to Change Ourselves and Our Clinical Approach to Today's Children." Should be a powerful conversation. So please join next week with everybody. Tonight's show, we have the schus and the honor of having world famous psychotherapist from Eretz Yisrael, Mishpacha magazine columnist, titled Off the Couch. He's right now on the couch, but soon he's going to get off the couch because, that's his title. And let's show me Mechazik Doilim tonight. We have a very deep topic to talk about and help thousands of people. We got a lot of emails. Maybe after you open up, Dr. Freedman, somebody sent me an email. I just want to read that email. It's more of a comment. And then before we go into questions, somebody sent me a very powerful email I would like to read. Tonight's shir is shir 115. And Shkoyach to Erna Ekfrit for coming up with the Gematria. We'll do Gematria now with every shir. It's the Gematria, Ahava Lo Gevul, love without borders. So hopefully that is Negea. You like that, huh? Hopefully that's going to tie in nicely with what we're trying to accomplish and understand here tonight. And we're going to open up with Coach Menachem Bernfeld. It's supposed to have Coach Menachem with us this week. Please open it up.
Shkoyach. Yes, I want to welcome everyone. Shir number 115, Baruch Hashem. And like Usher mentioned, that we're here every Sunday nights, and not always do we know what's going on behind the scenes. Last time, Usher, you had some fever, but you're still here. Whether we have fever or chasanas, Sunday night is Sunday nights, and Baruch Hashem, we're here, and it's a big schus to have with us again, Dr. Freedman, which it's just amazing if anybody knows what he does, Baruch Hashem, for in Eretz Yisrael and for Klal Yisrael. There's so much, and Hashem should give him koyach. He should be able to be mamshach. And tonight's topic, how to support families in mental health crisis. So how to support families is already like the next step. Mental crisis itself is such a big topic. And Baruch Hashem, we've seen a lot of progress, whether it's with this program, with many programs out there, to be able to talk about it, to bring it out, to put it on the table, and understand that there is what you can do. You don't have to be in the dark. And the Baruch Hashem, we've seen a lot of progress. I believe with the medication also, which we'll hear probably a little bit more from the doctor, compared to 20 years ago and today, there's a lot of improvements. So maybe when we grew up, people were scared, and the side effects. But today, if that should hold you back, you have to speak again to somebody who knows what's going on so that they can guide you. Because, yeah, it is a sensitive topic. And again, every family is different. And even with all the improvements, even with all of Baruch Hashem, where we are today's days, there are still people that are sitting in the dark. You'll be surprised. Whether it's hard for them to admit what's going on, and they try to push it off, as much as possible. Whether it's a family member, a child, what are we going to do about shidduchim? So they try maybe to hide it. It's hard, and everybody in their situation and their own family, the way they look at it, the way they take it. So I think it's a good idea to talk about it, bring it out, so that you can eventually find the right guidance, the right help. And before we start, I just want to mention, I heard in the name of Rabbi Yaakov Meir Shechter that Hashem sent us the medication today's days. He sent it to us because he knows we need it, and it's all from Hashem. And in other words, it's a mitzvah. If somebody needs to be able to continue in life, and the only way you can do it is by taking something which Hashem created, then it's a avlanatu. But yes, it does take time. It's a sensitive topic. Just to face reality might be hard. So just to sit and listen and to see where it goes, see how you take it, see maybe you can take the next step to improve, whether it's seeking a therapist, a psychiatrist, or a rav, whatever it is, so you can talk to somebody to guide you. Mitzvah, we should have a lot of siyata d'shmaya tonight, and everybody should be able to hear what they need in Mitzvah.
Thank you, Coach Menachem, for a beautiful opening. For Dr. Jacob Goes, let me just say again tonight, overview, the topic is Ask the Doc from Off the Couch, how to support families in mental health crises. Hashem should be a deep topic. We want to cover, all different aspects of it. Dr. Jacob will open up. Tonight's share, we're going to learn, first of all, for Arnoyach Street Shver, it's a yard site tonight. Sholdov and Naftali Tzvi, via Schus from Neshama. And we also learned the share. We got a call last night from a friend of my wife's that the young couple, the husband went to the hospital. They can't figure out exactly what's wrong. But Menachem, they should get a full shalem. Menachem Mendel ben Dvorleah. And the schus, the shir from all the thousands of people, Menachem, they'll hear it. And afterwards, who knows how many people hear it? It should be a schus for full shalem for them. I'm going to read Dr. Jacob's bio quickly, the short version, and then we are going to give it to him. Dr. Jacob L. Freedman is a psychiatrist and business consultant based in Israel. He's the author of Off the Couch and Mishpacha magazine, as well as 2 books from the Menachem publishers. When he's not with his patients, Dr. Freedman can be found learning Torah in the Old City or hiking the hills of Jerusalem. Can most easily be reached via drjacobfreedman.com. And it's chus to have you again. Dr. Jacob, the floor is yours.
Thank you so much for having me, Reb Asher, Coach Menachem. Big zuchus to be here. You'll forgive me that I'm a bit chayzerig. I have a sinus infection as a kapara for the generation. So hopefully that works out. I think you gave me the bug when I come on again next year. Coach Menachem, watch out. You got to have your vitamins. We're here to talk tonight about supporting families in the midst of a mental health crisis. And of course, we can answer any questions that anybody has. I think the most important thing to know is that a lot of people are struggling out there. Every single family at some point will deal with a mental health challenge. That's just the MS. I gave a talk in a big city earlier this year with about 20,000 families. And somebody asked me to just give over some epidemiological data, just, who's dealing with what. So again, city with about 20,000 families. And the first thing I said was, there's going to be 2,000 moms in this city who will experience postpartum depression at some point. There's going to be 400 moms and dads who will experience psychosis and schizophrenia at some point in their lives. There will be 1,000 parents who will experience bipolar disorder. There will be thousands of people with OCD and with addiction, children with ADHD, and L'tzarenu Arabim, people who will have traumatic experiences. And then, of course, there will be people who will die from suicide. Suicide is the #1 preventable cause of death in young adults and adolescents. So whether it's Ramat Beit Shemesh, Monsey, Brooklyn, whether it's Manchester, Oive, this is stuff that happens in our community. And if we don't talk about it, then we can't possibly come up with solutions as a community to essentially help our loved ones and help our neighbors. So Grocer Yasher Koyach for having me here to talk about this today. And that's really the goal, as you said, Coach Menachem. You know, if we're not doing a good job talking about this, then we're not doing a good job preventing the next crisis from happening. So I certainly appreciate you having myself and other professionals out there to essentially discuss solutions. You can't have a solution unless you have a problem. You don't have a problem unless you have Coach Menachem talking about how we can address these issues and Rav Asher quipping on the side. Here we are. I'll just tell you a quick story. There is a town that has a lot of Americans nearby. And the mayor of that town is a really funny fellow, and he always does a good job of going to schmooze with the Americans one Shabbos a month, to ask them what's going on, what challenges they're having, what concerns they're having, how he can make the town a more livable place for us Mefunakim Americans. You know, we're a bit Istamis compared to the Israelis here in Eretz Yisrael. So the mayor of this town goes around asking folks, you know, essentially how he can make it more American friendly. And I knew this fellow. He gave me a call one night and told me about some of the things that was happening with his son, who was talking about the Mossad and talking about wearing 4 different types of tefillin a day and even at nighttime, and Mashiach is on the way. And I told him, you know, you better not wait, and you better get him into a psychiatrist as fast as you can. This fellow brought his son in to get evaluated, and there was a problem where the son was unwilling to follow the treatment plan and ended up being hospitalized. I got a call from this mayor, this friend of mine, and he was telling me about the experience in the hospital and how stressful it was, and how his wife was shuttling back and forth visiting, and how his older daughter was bringing food back and forth, and about his challenges trying to manage the kids at home and to deal with everybody's stressful reactions to the family crisis. And this fellow's son was hospitalized for close to about 3.5 months when all was said and done at a long-term hospital here in Israel. And through the process, because this was such an intense challenge, this fellow stopped going to the monthly town hall meetings for the American community where he lived, because he was very overwhelmed. He had a lot on his plate. He spent Shabbos oftentimes nearby the hospital in order to visit his son. And the combination of whether it was him or his wife being away for Shabbos, it became impossible for him to go and schmooze at the American shul. And people started to talk about him, that he didn't really care, that he thought he was a bigwig, that he enjoyed to hang out with the Askanim. And there was a lot of interesting Lashon Hara about why this local politician was no longer interested in hanging out with the Americans. He wasn't interested in trying to help them out. He was just interested in getting the vote a few cycles back. And I remember hearing this one day in Shul and quoting the Hofetz Chaim magnet that we all have on our fridge that says, everyone's fighting a battle that you know nothing about. And I love being the Lashon Hara police periodically, but it was the truth. I didn't obviously reveal anything about what I knew, but the truth is you have no idea what other people are dealing with. And when you consider that 1 in 3 people have a mental health issue, whether it's substance use, depression, anxiety, trauma, addiction, at some point in their life, that's a lot of people. Everybody's going to have a challenge at some point in their family. It's just frankly inevitable. And the difference between having a mental health challenge in one's family versus having a machla is that when somebody has a medical crisis in their family, there's many great organizations that will come running to their need. And everybody knows about what's happening with the young girl and her condition, and she's in the hospital, and they want to help the family because how could Klal Yisrael not help somebody else in the community? But when somebody's having a mental health crisis, the stigma is so great that oftentimes people are either unwilling or just frankly too embarrassed to talk about it and to ask for help. So people end up being very alone during mental health crises. And that's a horrifying thing, to face these things alone and without the help of our community, which is otherwise such a tremendous strength. Baruch Hashem, our community does an incredible thing with chesed. We take care of our neighbors and our friends and our extended family because this is Klal Yisrael, and Klal Yisrael Arvim Zelazeh. But when it comes to a mental health crisis, oftentimes people are alone. And if you had to ask me what was the single greatest mitzvah that I've ever done in my entire life, it was probably helping out a neighbor whose wife was in the hospital. And this was a young fellow who had a toddler. And he came to me because he knew that I wouldn't judge him. And he dropped off his kid on Shabbos for about a month and a half while his wife was in the hospital so he could go to Mincha. And I don't think that that's the reason that it was the greatest mitzvah that I, watched his kid so that way he could go to Mincha. I think it was that I had to change his kid's diaper. So I remember having to change this kid's diaper because it was during the time that my wife would take a nap on Shabbos. So I was sitting there with some of my little kids and with his son and changing that kid's diaper every Shabbos so that way he could go to Mincha Gedola. And I remember thinking, I definitely got Olam Haba for this one, if not for some of the other stuff. But the truth is just practical support. We're talking about how you can help a family in the community going through a mental health crisis. The emes is practical support, the same way that you'd help them if they were going through any other sort of crisis. You would validate their situation, let them know that this is a challenge. You would let them know that you're not there to judge, that you don't need any other information because people are very embarrassed to share this information sometimes, or people are very confused or they don't have good information. You just let them know, I'm there for you. I know you're having a tough time, and practically, what can I do to help? I had a patient who once told me when his wife was struggling that the sweetest thing anybody did was just to have pizza delivered every Tuesday. No questions asked, nothing, not do you need any help, just one of his neighbors sent over a pizza every Tuesday. And when they had other food, they'd freeze it. But same help that anybody else needs, doing carpool. Dropping off Shabbos dinner, taking the younger kids to the pool when you take your own kids to the pool because you know that your neighbor's kid is in the hospital or your neighbor's wife is dealing with postpartum depression. You know what's happening. We all know what's happening if we think hard about it. Taking money, putting in an envelope and stuffing under the door if you know that the husband hasn't been able to work because of the challenges that he's had, or collaborating with any of the great organizations we have out there, whether it's Amudim, Relief, Mask, Ohel, Cheskenu, whether it's going ahead and, baking kugels with Mayor Brull and the Bikur Cholim out by you guys. There's always good stuff to do when it comes to helping folks. So those are a quick few words, and I know that based on the number of people that are leaving, that if people don't start to ask questions soon, it's just going to be the three of us. So I'll open up the floor.
Thank you, Dr. Jacob. Beautiful. Nobody's leaving, everybody's coming. Just on the iPhone, it looks like very active. It's not like that. We told you this before.
iPhones are us, or don't out me.
Okay, so let's start off with some polls. We have some live questions. I want to do the polls, and then I want to read this something that somebody sent in. I think it's a very great way to understand. Okay, 2 poll questions. Answer anonymously. Get a feeling from the crowd. The first question is: have you ever dealt with a mental health crisis, family or friend? 3 options: either yes, no, dealt with basic therapy stuff, but not like crisis. Please answer that. And then the follow-up question is: in your opinion, do you feel your community is doing enough for mental health? So it's yes, doing amazing stuff. B, no, can really use a lot of guidance over here. Or C, have a basic system, but not for more complex issues. Everybody answer those polls. We'll share them with everybody. And then we'll go to the first live question. Dr. Jacob will open live. I also want to read the thing.
Okay.
Yeah. Okay. 3 more seconds. Okay. So let's share the answers. Have you ever dealt with a mental health crisis, family or friend? A whopping 79% of people over here tonight said yes. 9% said no, only 9%. The other 12% said dealt with basic therapy stuff, but not crises. Dr. Jacob, any comment on that?
Yeah, I think that, 79% is most likely closer to 99%, but it's not surprising because nobody does anything wrong that they get struck with mental health challenges. This is just things that happen in our community. This isn't like somebody is drinking a bunch and then just hops in the car and starts driving to have fun because it's like playing a video game. This is, folks who have the combination of genetic predispositions and environmental stressors that bring out symptoms of mental health diagnoses.
Okay, and the second question over here, in your opinion, do you feel your community is doing enough for mental health? And again, you get people from all over the world here now. 16% say yes, only 60%. 50% of people say no, not really, can use a lot of guidance. And 34% of people say have a basic system, but not for more complex issues. Want to comment on that?
Yeah, so I think that this is great because there was a time 20 years ago, as Reb Menachem said before, where there wasn't too much. There were just lone askanim who were fielding phone calls. And Baruch Hashem, you look at some of these organizations who have built tremendous networks. You look at how many people are working for Amudim over a short period of time. You look at the fact that Relief Resources is a name that's available in every house that folks are familiar with. I know there's a great new organization over the past few years in Lakewood called Kanfei Fega that is there to support families who are going through crisis. And this is a good trend. Is there more work to be done? For sure. And I think that the more that people realize that there is more work to do, the more they'll be willing to not only support these organizations, but also to take it to new places. The reason that any of these organizations was founded is because of people who were struggling massively and had tragedies in their families. And when people realize that they are not alone, and then they're interested in going out there and helping. That's what Klal Yisrael does best.
Okay, I want to read an email that somebody sent me right before the share, literally 2 minutes before the share, and then we're going to go to the first
As
one.
long as it's constructive criticism.
It's something about you, is that okay?
Sure.
I'm joking. I think it's a very important thing to read. Not a question. I just wanted to say that my family went through a mental health crisis with my 12-year-old son and had to send him to a program for a couple of months. It was a brutally hard time period, especially the nights of Hanukkah, where I cried and cried by the menorah. We were pretty open with our friends and family, and the support and the love we received was carried to us through time. People brought us over and sent gifts, letters, food, money. It was life-saving. So if anyone wants to know, if anybody knows of a family going through a mental health crisis, just send a pie pizza with a note, drop off some challah before Shabbos, or send a text, say that we're davening, show that you care.
That's exactly what we're talking about. Because this is essentially the same experience that a similar family would have if their child was admitted to CHOP for treatment of a machla or something similar. But when people are experiencing mental health crisis, again, there's not only the embarrassment that the family feels, but there's the fear and the concern and the lack of understanding that everybody else feels. What's wrong with these people that they have a kid in the psych hospital? Why are these people have a kid who was admitted to a detox or a rehab? And everybody's embarrassed to talk about it. So again, the MS is, as this individual said, you don't have to talk about it. You just have to drop off a pizza or a challah. You don't have to say anything. You just have to say, we're taking our kids to the museum. We're taking our kids to the water park. Can we bring your kids too? You don't have to get all the details. You can just say, just want to let you know we're pulling for you. If you need us for anything, we're around.
Beautiful. Okay, let's go with the first question live. You're on.
Thank you. Thank you, Rusher. Thank you, Chris Menachem, and thank you, Dr. Freedman. First of all, we do miss your column in Mishpacha magazine. That was a highlight of the week. So as soon as you bring it back, we'll be very happy to see it again. The question, as a friend, spouse, mentor, rabbi, how do we know the signs when someone just needs some chizuk and when they need to be sent to a clinical medical professional, and this is not just somebody who needs a little pat on the back?
I appreciate the positive feedback, Rav Elephant, and I would say that this is such a good, important question. I'm really glad that you asked it. The most important thing that I can do as a from mental health professional is to have a relationship with a poisek that I can ask a lot of the questions that come up in my office to. Somebody who's bucky in the halachas of mental health and of medicine in general, because I get a lot of interesting quandaries beyond all of the horrible lashon hara that I hear all day long. And it's important that I have somebody to turn to that I can ask my questions to, because a lot of times there's no clear answer. So I would say that in the same sense, it's very important for the Rav of a community, for a poisek, to have a relationship with a professional. You and other folks should have a relationship with a psychologist, with a psychiatrist that you can call up and say, listen, there's a guy in my community who's having problems with his wife, and his wife says that he's always bothering her about halacha and telling her that she's messing up the kitchen and that she's not makbid on taras mishpacha. How can I know if he has OCD or if he's just being a difficult person and needs to be told to relax when it comes to chumras? So the only way that you would know that is to have the ability to conference with a professional who really understands such an issue. And I can say that I am so grateful for these relationships that I've developed over the years with local community leaders to be able not only to ask my questions, but to also provide support, guidance, and education to Rabbanis about what's striking to me as a mental health concern versus as somebody who might just need a bit of chizuk, as the Rav said. And I would add to that, you know, a good from clinician, that's what we do, is we understand the difference between what's culturally appropriate and what's a symptom. I used to always tell my med students that there's a guy who's currently in the hospital that talks to God 3 times a day and has a protective t-shirt that he wears with these strings that keeps him out of trouble, and he hasn't shaved in years. What's the most likely diagnosis? And they would say, schizophrenia. And I would respond, Yiddishkeit, because that's me. So you have to understand the difference between what's culturally appropriate and what's a symptom. And that's something that really only a person who's mamish bucky in the Torah Welt can do. So I think it's so important to have just a frum person who's a professional that you have a kesher with, Rav, so that way not only can they help you, but you can also help them to better understand the halachas of these challenging situations. I hope that answered the question.
Okay,
Go ahead.
Jacob, somebody texted me this question. Can I read it? It's a tough question.
I'd be honored.
Okay, my husband struggles with bipolar disorder, and he's more compliant with his meds, but then he's more compliant with his meds than most. But he also struggles heavily with it, and also struggles to give me dependability I need. What hope can you offer for those who are married to those suffering with bipolar disorder?
That's a great question. So I think, first of all, you have to know that you're not alone. Bipolar disorder is probably about 2% of the population, is a good number. So that means that if you live on a street that has, 50, 100 families, that for sure you're not the only person who's experiencing this challenge. And there's a great organization in the States called Chazkenu, which is a call-in support group for frum ladies that have loved ones who are experiencing serious mental health challenges. And, knowing that you're not alone, I think is very important. Hearing things that have worked and things that have not worked is very important. I think that I always encourage my patients with significant challenges to bring their spouses, to bring their grown kids, or to bring their parents to the appointment, so that way we can all be on the same team. Because a lot of times with my patients, I get, an hour in the office with them, and I might be an expert in psychiatry, but I'm not an expert in Yossi Cohen who's sitting in front of me. Whereas Yossi Cohen's wife can come in and say, I know Yossi looks good, but every single night he wakes up at 3 a.m. to start davening Tikkun Atzois. And if I don't hear that from her, I'm not going to have the information, because Yossi might not volunteer that. In the same sense, I think that there are some things that you could share with the doctor that would implicate the treatment itself. For example, if you'll tell the doctor that your husband doesn't take his medicine, a couple times a month, the doctor might suggest medicine in the form of injection that comes once a month, because then even if he forgets periodically, it's still in his system in an ongoing way. So for people who have a tough time being adherent to their medication regimens, whether it's because they forget or they get frustrated or they're embarrassed, long-acting injectable treatments, there are some shots that you can get once every few months that are great at preventing relapse. So I hope that's helpful, and I'm pulling for you because I know that this can be a challenge, but you'd be surprised how many great people have bipolar disorder, whether it's some patients that have been zoche to help who are doctors, lawyers, famous musicians and entertainers, admorim, and their loved ones. So you're not alone, and there's good people out there.
Okay, beautiful, Dr. Freedman. Okay, you're on.
Hi. I was just wondering, this is sort of an elaboration of what Mr. Elephant was saying about recognizing, signs of mental illness. You feel you're on the sidelines, you don't know what to do. What about children, like a child who might be watching a parent through an episode? Do you, I know that there are courses now, things to help, instruct children against predators, for example. But is there anything going on? I wish there had been when I was a kid. Like if you tell your mom or your daddy you're just not acting normally, or there's, something they may sense something's wrong but not know it. Are there those kind of programs or, people to help the child that way?
That's a great question, and thank you for asking it, Mrs. Kenter. I think that a good school will have support staff. Most schools now, certainly in the States, have either a psychologist or a social worker that's associated with the school. And here in Eretz Yisrael, many of the yeshivas have a psychologist or a social worker that's associated with the program. And it's really the job of that individual to be in touch with all of the kids when they come in to meet them, and to check in throughout the year, to really have their finger on the pulse. And this is a great resource for kids, because it allows them to have a professional to discuss their concerns with, and it also allows for there to be a liaison between the teachers and the Anhala and a mental health professional who's dafka able to provide an appropriate intervention. School psychologists are not there to get anybody in trouble. They're there to help people to be successful. And part of the role of the school psychologist is not just to help the kids, but it's also to identify parents who might be in need of extra resources. So I really encourage always the Anhala of schools, of yeshivas, of seminaries, to have mental health staff on board, to have their meetings with the social worker or the psychologist present, so that way we can address and notice any red flags of families that might be in need of support. I hope that answers your question.
One second. Get on mute, Mrs. Cantor.
Oh, he heard me before, though, right? Yeah. Yeah. I was just to elaborate. What about a child that might be too naive to understand, or caught in the crossfire? Maybe, it's like the fourth child the fourth son at the Seder who doesn't even know how to ask, or the third son, maybe, like, what's going on? I mean, getting a child to ask that kind of a, like, you may sense the child, something's going on, but the child may not even be able to articulate it. I mean, do you,
I think that's a great question. And I think that, children are a lot smarter than we think they are, which is what I think you're alluding to. And whether or not
they can recognize, there's somehow
whether or not they can put a name to it, they're able to recognize that things are not going good, or that things have changed within the family dynamics. And that allowing them to be a part, not of necessarily the decision making, but a part of whether it's the grieving process or the healing process, is very important, because whether or not we talk with them, they know something is up. So I encourage people to have age appropriate discussions with their children. And I encourage people to talk with the pediatrician to ask, what's an appropriate way to talk with the young children, or to talk with the mental health providers. A lot of times, for example, when I have a patient who's struggling with an eating disorder, I'll talk with the family about how to address this with the other people in the family, whether it's the extended family, and how to deal with this during a chag, or with the kids in the house, to understand what's healthy eating habits and what's not. When somebody's going through an addiction, when somebody's hospitalized, the little kids need to know, because otherwise they'll be in the dark, and frankly, it'll be more scary. So we have to think about what's an appropriate way to address these issues. This is a great question.
Thank you.
Okay, let's go to the next live question. You're on.
Thank you, and thank you for this opportunity. My question is around medication, psychotropic medication. So is there like some guidance that can be spoken about when it would be indicated? Because from in my own circle, I've been hearing people who are maybe told by their psychiatrist to go on medication, but they're afraid of it. Either they think it's a quick fix, like, why do I need medication? Why can't I just figure out how to do this? Talk therapy. There's all these different therapeutic modalities to try. So yeah, and some psychiatrists are very quick to just prescribe medication. So is there some guidance that we can get, and besides all the other the issues with medication, that side effects, being dependent on the medication. So when is medication something that is the correct approach, and when is it not yet the thing to try?
So that's a really important question, Reb Menachem, and I appreciate you asking it. I would say, first of all, every case is different, so we need to keep that in mind. And what worked for Levi might not work for Shimon or Ruvain, and we have to keep that in mind. I would encourage everybody to be an active consumer. We all on the stock have access to internet, and I would encourage you not to go down the dark hole of strange things on the internet. Certainly, if you Google Jews, you'll find out that we're in control of the media, the economy, and everything else. And if you Google psychiatric medicines, you'll find all sorts of interesting information. But I would encourage folks rather to look up the information on the Mayo Clinic website, on the Mass General Hospital MGH McLean website, about different diagnoses and different available treatments. Being an educated consumer allows you to ask the right questions during your appointment, and I think that's so important. I would agree that there's milas and chesroinus. There's advantages and disadvantages, pros and cons to any derech that you'll take, no matter what it is. And a good doctor will help you think through the pros and the cons. A lot of people are nervous to go to a psychiatrist because, as you said, there's a thought that some psychiatrists will jump to prescribe medicines. If you look at the data, most psychiatric medications are not actually prescribed by psychiatrists in America. They're prescribed by family doctors. So psychiatrists actually have a bit more information about the pros and the cons, and when it comes to making diagnosis. So unless you're brought in shackles to the prison psychiatrist, which none of us should know that experience, it's a voluntary evaluation. I always tell my patients, you walked in here and you're going to walk out of here. I'm not going to force you to do anything. All I'm going to do is to give you some advice. And in the end, you'll be the one who makes the decision. We have to encourage our patients to have achrayus and to be in charge of, in the end, the decisions that they'll make. And I'm only here for consultations, for AITSs. And if you think that my AITSs are good, great. And if you don't, that's okay too. It is a free market economy, and there's lots of good firm psychiatrists out there, Baruch Hashem. I think that it's important, one general rule for when medications should definitely be considered. I think once folks are starting to get into trouble, so once we're talking about people that are at risk of getting fired because they're no longer effective at work, when we're talking about kids that are going to get kicked out of school because of disruptive behaviors, when we're talking about people that can't take care of their children, when we're talking about physical dysfunction. So, again, mental illness is a physical condition, right? Neurology is when people have brain dysfunction that causes issues with motor function and sensation. And psychiatry is when people have brain dysfunction that causes behavioral challenges and personality challenges. So when a person's goof isn't working, when they're feeling schwach all the time, when their appetite is changing, when they're experiencing strange things, hallucinations, delusions, when they're tired all the time, or when they can't sleep, when their goof is hurting, that's when medication is for sure should be considered much more strongly, because the goof doesn't stop working until it's taken a pretty big hit, whether it's a cardiology problem, a kidney problem, a lung problem, or a brain problem. You know, we can take a lot of hits, thank God, and still keep on working. But once the body's hurting, that's when medication should be more strongly considered. And as far as side effects, you know, there's a side effect to crossing the street. There's a side effect to driving your car to go pick up a box of cereal and milk at the local Makolet. I think that we need to understand that one of the greatest side effects out there is letting yourself suffer for an extended period of time, because the further you descend, the longer it takes to go back up. And the further you descend, the more challenges you'll have at work, at school, and with the family at home, and that stuff can be tough to repair. So I think that, again, you can't go wrong with seeing a doc. You don't have to take any medicines you don't want to, unless there's a court order suggesting otherwise. And with that in mind, again, sometimes people come into my office, I would say 100% of people get recommended exercise, good sleep hygiene, sobriety, and about 90% of people get recommended psychotherapy, and probably about 50% of people get recommended a medication. So a good psychiatrist will see things in 3D, and you know, if you bring in a loved one to the appointment with you, who provides collateral information about what they think is going on, if you're an educated consumer and you come in with questions, you know, that's great, because I'll always ask my patients towards the end of an appointment, what questions do you have? As opposed to, do you have any questions? Because I'm expecting that you have questions. And the more questions that you bring in, the easier it is for me to provide you with answers according to the research and my own experience. So I really appreciate your question, Rabbi Menachem, and I hope that answers it. Oh, I got a thumbs up emoji. Great. All right.
Thank you, Dr. Jake. Since you love questions, we have so many questions for you tonight, so we're good. Okay, you're on live.
Okay, thank you so much, Dr. Freedman, for being on tonight. I'm so grateful to you for the role that you play, both in our community and all the ripples out from there. So my question is, you had a question earlier about someone asking, how do you stay and cope within a marriage? So I chose to leave a marriage with somebody who had a personality disorder and some mental illness issues, who refused to acknowledge them and do anything to help himself. And it's been, you know, it was very destructive. It was a fairly longish marriage. And I worked very hard to create distance and create boundaries, and that's an ongoing, you know, avoda, and will be. There are children involved, so that, you know, there's only a certain amount of distance that you can create, but in the process of trying to both still cope and heal, I have one question and one, I don't know, kind of just thoughts to share. So my question is that as you're trying to heal and kind of put the experience somewhere in your head, how are you supposed to feel towards such a person who has created a lot of pain and suffering in your life? You know, in the earlier stages, it's like, you know, you go through the mourning stages and the anger and then all that kind of stuff. But once you get to a little farther along, is it pity? Is it indifference? Is it trying to work towards forgiveness? You know, of course, there's all this, you know, things from the Torah that will talk to us about you can learn a Shabbos Bitachon, you can learn all kinds of Torah to help you with, how to frame suffering in your own mind. But until before you get to the level of being a tzaddik, so where do you put that person in your head? How do you feel towards them?
So I think it's very brave of you to share this information, because I believe that there are a lot of people that Baruch Hashem have the koach to deal with these challenges when their spouse is engaged in treatment. And then I think there are a lot of people who make the right decision for them and their family and move onwards when their spouse is not taking achrayas, or when the situation is frankly unsafe. The most important thing that I'm hearing from your journey is that you're being honest with your feelings. And that's so important, because most of the time people don't explode. They don't smash things and hit other people and start screaming unless they've been angry for a little while. Most of the time, people don't get defensive unless they've been nervous or felt invalidated for a long period of time. So when we're honest about our feelings, it allows us to act in a mature and a professional way. And it sounds like you've done a lot of bodhisattva to make that happen. I think that people who have spouses who are going through mental health crises should be very open to the idea of going to their own individual therapy. Not because a person whose husband has alcoholism has done anything wrong or has their own diagnosis, but because it's a very stressful challenge. And I think having a safe place to talk about one's feelings is critical. I think that, a man whose wife has bipolar disorder, would certainly benefit from therapy to talk about the experience, to talk about his anger, his frustration, his questions to the Eibusher. I think, having a Rav to talk to, as well as having a therapist, is very helpful. There's also these groups like Chazkenu does fantastic things for women who, need the support. I think also specifically in addictions, spouses and children and parents can go to Al-Anon meetings and can participate in these support groups also, to realize that they're not alone, to hear what works, and to understand acceptance, which is so important in these challenges, because nobody chooses to marry a spouse who has a serious mental illness or an addiction. Nobody wants to have a child who has schizophrenia, bipolar disorder, and the philosophy of 12-step programming of the recovery movement is so beautiful. And God give me the serenity to accept the things I cannot change, courage to change the things that I can, and the wisdom to know the difference. Rabbi Torsky Zatzal, who was the Admor of recovery, always said that people who have addiction benefit from 12 steps, and people who do not have addiction benefit from the 12 steps. He wrote a great book called Teshuvah Through Recovery, in addition to 80 other great books. And I think that there's a lot of wisdom that people who are going through mental health challenges can get from 12 steps. I am not an addict, but I still will periodically go to meetings and learn over the 12 steps, because there's a lot of wisdom there, and I've seen how much it helps my patients. And I think there's what to be said for pursuing that as a means of both support and personal growth. I hope that answers your question, and I wish you lots of success, because it seems like this has been a challenge, and Hashem should bench you for all of your honest bodhisattva and trying to help both yourself and your kids throughout this process.
Amen. Thank you so much.
Just Dr. Freedman, is it okay to feel angry?
Oh, of course. it's normal to feel angry. I'm sorry I missed that point. I went off on an AA tangent. The only thing that's not okay is to deny that you're feeling angry, because that's when people do out of control, explosive things, because they've just let it build up for too long. So again, that's why therapy and support groups can be so important, because it gives you that safe place to discuss how you're feeling, and it encourages you to be honest. That's why having a Rabbanis, rabbis, rebbitzins in the community who are bucky by this stuff and let people say things without the stigma of mental health and addiction. It's so important that we have these people in our community.
Mhm. And here's a question that somebody sent in. I've been married for 6 years, and in the last
Mazel tov.
things have started to become more and more difficult. Our children are hard to take care of. My husband is simply in and out of jobs. We're financially struggling, which I understand and accept is the situation as of now. My concern is my husband's mental state. He seems sad, removed, depressed, shut down from me and the things that he needs to take care of, and he's not his usual self. How, as a loving wife, can I talk to my husband about the situation, or do I get family or a banim or a rav involved? How do I get them involved and get the proper help and guidance, which honestly, I have no idea what to do myself?
Okay, that's a great question. And, oftentimes a spouse will feel like their loved one needs help before the loved one themselves. It's impossible to free yourself from jail, is what the Gemara in Brachos teaches us, because you don't even know you're there half the time. So I think one thing that you can always do, which is a great resource, and I encourage folks to do, is call Mudim, call Relief. These are great organizations that are out there. Call Mask, call OHEL, any of these wonderful organizations that are out there, and have a confidential discussion with a case manager about what you think is going on. And this will be a person who, again, is a person in our community that speaks your language. The discussion is anonymous, and you can say, this is what's going on. What do you think I should do? That's one idea. Another idea is to have an open discussion with your spouse and to say, listen, this is what I think is going on. And I know that it's been hard for you. What do you think we should do? Here's another idea. In cases where you've already done that and your loved one is uninterested in getting any sort of help, I think that the question is, who will they listen to? This is why I love listening and working with the Siddush Welt, is because there's always the Admor Shlita who is at the top. And so, if you won't listen to your dad, if you won't listen to your cousin, if you won't listen to the Rav of the Shul, there's the Admor to tell you that it's time to go to get help. So in a case where a person is refusing help, the question is, who are they willing to listen to? And you got to think about who that person is. And there's no Lashon Hara about going and talking to the Rav of the community, going and talking to your Shver, because you're not doing this to spread any interesting gossip. You're doing this to save lives. You're doing this to save the marriage. You're doing this to protect your kids, because the children of parents who are going through a depressive episode don't get the love and the affection, and they don't get the attention that they need during that tukufa, because dad's just going to bed 12 hours a day and doesn't have any koach to play ball outside or to go to lavos ubanim. The children of mom, when she's dealing with OCD, have no idea why they're getting yelled at for walking in the house and not taking off their shoes. That wasn't a problem a year ago. Why is that a problem now? Why are you making me do sponja all the time? Why do I have to mop and sweep up the floor all the time? Why are you always yelling, Mom? And if the kids aren't aware of what's going on, and if the kids don't have support through the process, they're going to be hurting. So when you go and you get help for your spouse, you're not saying Lashon Hara, you're saving the family. Nothing less than that, to be perfectly honest.
Just a quick question about the people have a fear of reporting, that the therapist needs to report. How does that work?
So you're asking about mandated reporting is the term. So mandated reporting is when a licensed therapist or doctor will have concerns about the well-being of a child in the home, whether it's from neglect, abuse, or something else, and then they will call Child Protective Services, and Child Protective Services will then do an evaluation to think about how they can help the kid and help the family. This is not so that way Child Protective Services can take the child out of the home and put them in foster care, and the parents will never see their child again. That is something that happened 50 years ago. That is something that is still carried around as a rumor. Child Protective Services is so overwhelmed and has no resources that L'tzareno Arabim, they leave kids in houses where there is serious physical abuse happening, and they're aware of it. They leave children in houses where there's ongoing sexual abuse. If only they had more kochos and resources. Here in Eretz Yisrael, the Revacha, the welfare department, the main thing that they do is just offer free therapeutic services and offer additional childcare resources. You know, somebody goes to the Revacha and because they're having a tough time with their kids, the Revacha offers extended GAN, extended preschool, you know, throughout the afternoon. They offer in-home resources and teaching. They offer free therapy. They get people extra financial resources to help feed their family, to pay their bills. And also here in Eretz Yisrael, at least, the Revacha is from people. You know, it's from social workers who want to help families in their community. And that's very important. I think it's a great career for young professionals, new social workers, new psychologists, to think about working with the welfare department, so that way they can help the community and learn a lot as well. Should you be concerned? If the welfare department is going to take away your kids, that's because it's pekuach nefesh. They don't want your kids. They don't have the resources to take your kids. Most of the time, they just want case closed. L'tzareno Arabim. I wouldn't be afraid about this. I would rather realize that that's an extra resource for your family to be helpful. So forgive me if I'm giving a bit of a chutzpahdik controversial answer here.
No, we need to hear it.
Okay, Dr. Freedman, let's go to the next live question. You're on.
Well, hi, Dr. Freedman, can you hear me?
I got you. You don't have any arms. You're a disembodied circle over a jelly bean, but
Okay.
I can hear you.
I'm just thrilled that you're on. You're amazing, and I love your column. So I have a couple of questions. We've had a husband who's suffered from really severe anxiety and depression for about 4 years, who's getting treatment, who's very cooperative, who, you know, wants to get better and has gotten a lot better, who's had his ups and downs with different meds. And there's a young teenager who just felt like his dad wasn't there for him for high school. And he's correct, his dad wasn't there for him because he couldn't be. And so the young teen has had therapy and is off learning in Israel now, and he's doing very well. But, you know, it was very traumatic to see his dad basically not functioning, and he's still kind of angry and feels detached. So I guess I've taken the approach like it's in Hashem's hands. The kid's getting therapy, you know, the dad's trying, and that we just have to daven and wait and be patient. Like, I don't think I can force a relationship I mean, the kid's being nice and respectful, but he's very, very distant and guarded. And I'm guessing that's probably just to be expected. Is that right?
Well, first of all, thank you for having the courage to discuss this situation. I think it's a common one, and it really highlights the importance of having an open dialogue in the house from an early stage, because the earlier that this young man gets into therapy, and the earlier that he has the words to discuss how he feels, the easier it is on the family, and the easier it is for him, because he doesn't have a big buildup of emotions.
Okay.
I think it's also important because if there is a serious mental health issue, you know, teenage years and late teens, early 20s is when the genetic predisposition rears its head, and he would be at an elevated risk of his own challenges. Also, young men who don't have present parents are at an increased risk in our community of substance use. So, you know, providing him with healthy resources and supports is important, because otherwise he'll provide himself with unhealthy resources and supports. So mentoring programs are really big here. You know, we should all be lucky enough to have uncles that can pinch hit, big brothers, cousins, neighbors, friends of the family that can help out and take this young man to a baseball game, take this young man to shul, help this young man prepare for his bar mitzvah laning. The more support that the community gives in a proactive way, the less reactive crisis management we have to deal with down the road.
So that if I could just ask another question, I mean, unfortunately, in our community, it was really, we didn't really get any help, and we became pretty isolated socially, and it was very difficult. We basically are down to like 3 good friends, and I feel really grateful for them. And so that's something that's really frustrating. And I'd like to try to get back to normal now that he's doing better, but I still feel like scared and awkward. Like he's, you know, still kind of quiet sometimes, you know, was always a shy person. And it's just, I don't know what I'm asking exactly, but is there any suggestion on how to get things back socially and to expand our circle instead of feeling so isolated?
So I think that you being able to reach out to other women and not feeling so alone yourself will be helpful, because the stronger you are as the pillar of this family, it seems right now, the easier it will be for you to create more opportunities for healing and moving forwards. And I would also say, you know, now that you've experienced this, as things settle down more and you have more time, you might want to get involved in some of the good organizations that are out there, or to start a similar support network within your own community, because these are common challenges. And if there is not this kind of support within your community, then there should be. And I think you'd be not surprised, but you know, as you're aware, there's a lot of people dealing with these challenges. You're not the only one. I'm pulling for you.
Okay,
Yes,
I
Hashem.
want to ask a question that came in, and so it's from the person themselves. I have so much going on, very, very blanket statement. I don't know how to keep my relationships with other people during this time. Nobody really knows what's going on in my life, and I don't have the energy to talk about it with people. I feel removed from friends and neighbors. I just want to feel normal. What advice can you give me so I can be myself?
Let me make a pitch for therapy. Pitch for therapy goes like this. The only reason not to do therapy is time and money. But if you go to therapy, you will be a more efficient person because you'll learn how to juggle chainsaws at least emotionally and socially, and therefore you'll be more effective at work and you'll have more money. So therapy is a great way to ground yourself, to center yourself, to think about what are your goals and how you'll achieve them. And in a case like this, I think that therapy is something to give a shot. You know, there are a lot of great therapists that work by Zoom now after the pandemic of the past few years. There are a ton of fantastic frum clinicians out there. Some of the best people in the world are frum people. And so there's no shortage of good folks out there to work with you, even if you live in Saskatchewan, which I imagine you don't.
Okay, Moidik, let's get her on. Where is she? Okay, you're on.
Hi, Dr. Freedman, Mrs. Rosenfeld here from Confe Fega.
Woo! I was wondering when we were going to have you say hi.
Yeah, hi, and thank you for all your support.
So 1 second,
So-
Thank you for helping the Velds.
We're trying.
Mrs. Roosevelt, why don't you first tell everybody who you are and what your organization does?
Okay, so I'm the director of Confe Fega. It's an organization in Lakewood that services Lakewood families only. And we support families where one of the parents is struggling with a mental illness. And the way we support the family is by providing you with a volunteer advocate, and a shout out there if anyone wants to volunteer. We're looking for volunteers all the time. And the volunteer gets basic training. She's not a professional. She becomes a good friend, a support system to the family. Once she speaks to the family 2 or 3 times a week, sees how it's going, and really the chizuk, the support, just knowing there's someone there that gets you and that gets what's going on, makes the world of difference to these families. Then we have other programs. If the volunteer feels there's necessary for a big sister or a homework helper, we have other programs that we provide, but it's really basic support. My question to you is, Dr. Freedman, do you find that people wait much too long to reach out for support? I find that a very good day in Confe Fega is a day when I get a young couple in with 1 or 2 kids and their family's relatively young, and they reach out for help. Versus, and I tell them, you don't know what a gift you're giving your family and your shalom bayis and your future. Versus if you wait so many years and you don't talk to anyone about it and you don't reach out for help, the complications are that much greater. There's a spouse that's struggling with mental illness. There's the other spouse who's trying to be as being a single parent, because and the support system for the unwell spouse, and then there's a bunch of children that are suffering and struggling. Do you find that people are resistant to reach out for help, and why do you think that's the case?
So that is a really, really good question. But before we give an answer, I just want to say, Groiser Yasher Koyach, you are doing such good stuff. The program that you have is a model for every community. The fact that there are other communities that don't have their own version of Confe Fega is tragic. This is a grassroots support network that has ATSUS from Rabbanim, that has ATSUS for mental health professionals. You are out there preventing divorce, preventing hospitalizations, getting people back on track, and wow, you're
Thank
doing
you.
it.
And it's not that complicated. Anyone that wants to join our volunteers, we welcome you. Go ahead.
I would just also encourage folks that want to bring a similar program to their community to reach out to your admin staff to think about how well, it hasn't been easy. I think you've had a lot of siyata d'shemaya because you're out there trying to help folks. So I also want to thank you. Confe Fega was instrumental in supporting a project that I was involved in over the past few years, writing a kid's book explaining the challenges of mental health for young kids, so that way they have an understanding and a safe place to discuss how hard it is when somebody in the family is experiencing a mental health challenge. So I appreciate your support on that project, and whenever you need me, I'm happy to support all the great work that you're doing. The question is, do we wait too long? And the answer is, of course. Here's an interesting statistic. The average person with OCD will wait well over a year and a half before they seek any professional treatment whatsoever. Here's another statistic. The greatest predictive factor for how a person will respond to treatment for schizophrenia is the amount of time that it takes. So if a person has been experiencing symptoms of psychosis, hallucinations, delusions for a month, 2 months, 3 months, they're much more likely to avoid hospitalizations, to be a functional member of society, to live independently, to get married, to have a career. Whereas if a person waits for a year before getting help, there's so much neurological damage done that the chances of them living independently, of working, of having a family are significantly less. So it's so important to get help in a timely fashion. You know, an ounce of prevention, Lord, it's fantastic. What can happen when we intervene in an early state? We prevent hospitalizations, we prevent divorce, we prevent addiction from going from one generation to the next. And I think I always give the mashal of the Grand Canyon. If you park your car and you go out to the edge of the Grand Canyon, it's a 15-minute walk, and you snap your pictures, and it's a 15-minute walk back to your car. If you hike down into the Grand Canyon for an hour and you want to walk back to your car, it takes about 2 hours because now you're going uphill. If you hike all the way in, you got to spend the night, and it's going to take days to get out. So the longer we descend and the more time that we spend suffering, the harder it is to get out. And people are more likely to need more intensive therapies, to need more medications, different types of medications, and it leaves scars on families and on marriages. So earlier intervention is about saving families and saving lives.
Is the
And
reason
I would love to put in one more thought. If you're asking how do we support families, what I'd love to ask the Olam out there is that if anyone does speak to you and confides in you that they're going through a depressive state or a difficult time, or they're finding themselves not enjoying life anymore, or their spouses, please encourage them to call relief, to make one appointment with a therapist just to check if there's a problem. So many times we hear, oh, we suspected it was a problem. My mother said it was just this, and my father said it was just that, and my sister said it, no, just do some more exercise or eat healthier or get some more sleep. And unfortunately, they go without help for so long. So I think that's in addition to obviously all the practical help that you can give to a loved one. You couldn't have said it better. We had one woman that walked in and said she had a neighbor whose child had cancer, Lailenu, and she watched how the suppers brought in homework helpers and support, and her husband was hospitalized for a psychiatric episode. She was all alone. She needed every one of those support system and that help. And she said, given that there's just so much shame, as much as we've come so far in the frum world to acknowledge mental health issues, but there's shame involved. I'm not going to the corner when I wait to the bus and telling them my husband hasn't been home for 6 weeks and I need help. So, all that practical help that you would give to a loved one when they're chas v'shalom diagnosed with a physical illness is the same kind of help that the families that are going through mental illness struggles are needing.
I can't overstate all of the good work that you do. The chesed that you're doing there is immense.
Thank you. Thank you.
So how do we make it a little bit easier, because neighbors are not sure if they'll appreciate.
I'm nervous. Do they see?
It's something that they're the neighbors are struggling. Should they send things over? Some people actually we had it on the past show. Somebody mentioned that they did not like everything they got. They felt like a chesed case. But the real question is, how do we open this up to make it easier for neighbors? Again, the family themselves is not going out there and saying, I need help, I need help. The neighbors are not sure if they'll feel comfortable sending something. So how do we make this a little bit?
Great question, Coach Menachem. I think that one thing that needs to happen is that the Rav of the shul, the Rav of the community, the Rebbitzin of the street, the fellow who's the macher in the community needs to have his finger on the pulse. And it's really the achrayus of the Rav to take care of his community. And it's the achrayus of the Rebbitzin to know what's going on with the women. And when community leaders have these relationships with mental health professionals to ask questions, it allows them to have a better understanding of how to do these interventions and how to go over to the house. And similar to when the Rav of the shul might approach the father and say, listen, I see that your kid is struggling with his Yiddishkeit. It's important for the Rav of the shul to approach the parents and say, I see that your kid is struggling with getting along with other kids. I see that your kid looks like he's struggling with a mental health issue, and I want to help. And yes, there is a lot of stigma, so things need to be done discreetly. But this is a very, very important thing that needs to happen. And I think that also, if you're embarrassed to go over and help, you can do it through an organization like a Kanfei Fega or through the Bikur Choli. And nobody wants to be a chesed case, but nobody also wants to have their kids go hungry because mom's in the hospital. And we should respect and not judge when people have tough responses, but things can be done anonymously. You can drop an envelope under the door at 3 a.m. when you wake up to do a Coach Menachem shir across the world. You can just order pizza and have it delivered and paid for. You can drop off a kugel and just say, hey, I like to drop off a kugel to the neighbors from time to time. And, people know what's going on. And we have to be Yotzi. Can I give a little drasha? Is that okay? Here you go. So, we had Parsha Shoiftim, and we end Parsha Shoiftim with the Egla Rufa. And, the Zakanim of the city have to go out when they find a dead body in the field and say, Yadayim lo shafku adadam hazeh, nenu lo ro. We didn't see what was happening to this guy, and we tried our best to prevent it. This wasn't us. Now, obviously, Prashad is, did we really think that these Zakanim were just out chopping people to pieces in the middle of the field outside of the Tehum? And the answer is no. But what they're saying is that, we didn't know that there was somebody who was traveling alone in the dark and didn't know where he was going, or we would have given him instructions. We didn't know that there was a hungry person, or we would have fed him. And that's what we've got to do in our community. Unfortunately, some people are going to refuse help when they need it, but we have to say, I tried my best to help this person. You can't save everybody, but you can try. And I think that's what Egla Rufa teaches us, which is that you have to go to bed and say, I tried my best to help these people. And, if they weren't willing to accept my help, that's okay, but I tried. And that's something, that I heard from Rosh Kolo said in the name of his Rav Wachsvogel, because we're in Lakewood, at least virtually here, Zitzal, is that, Egla Rufa is the mitzvah of Kol Yisrael Arvim Zelazeh. Every Jew is responsible for every other Jew. And, we got to do our best to try and help. It's starting to get light outside. So I'm going to run to Nate's at some point pretty soon. And I'm going to run to the facilities before that.
We go one more question. Give me like a time you need to end by.
I got a question. How is the Hasana? I'm sorry I missed it. Next time you got to fly me in for the Simcha, and I want business class because I'm tall.
Wow. Okay. Definitely. I'll speak to Confiona about it. Okay. What time do we need to end?
I got about 3.46 minutes left to go.
Let's go to closing because I had a bunch of other questions. So we need more time with you, Dr. Freeman.
I'll
Okay.
come back.
Unfortunately, for all the people that I wanted to ask live, and there was a lot of very important questions. Dr. Freeman davens Nate's every day, so we got to end. We got a little more time. I think we start early, but let's roll into the closing. Then we'll leave a closing statement. Again, I guess Dr. Freeman for coming on, giving chizuk. We had so much more to talk about, so you definitely got to come back again. And again, tonight's share is 1:15. Thank you for joining, being part of it. If anyone wants to join the WhatsApp me at 848-525-0066. Go to menachembernfeld.com. Next Sunday, Menachem, September 11th, will be world famous motivational speaker, teacher, works for teenagers from Cleveland, Rabbi Yossi Ben Shushan, also writes articles in Mishpacha magazine. The topic is a call to action, why we desperately need to change ourselves and our clinical approach for today's children. Please tell everybody to join. Again, tonight's share is 1:15. You could have any questions, you can go email coachmenachem@gmail.com. If anybody wants to get a hold of Dr. Jacob, your website is drjacobfreedman.com.
With an L in the middle, like Labe.
Right, drjacobfreedman.com. If you want to get in touch with him. Again, I want to thank all the advertising sponsors. I'm just going to wrap it up that we touched one nakuda about being there for other people, but there was so much more detail that we need to get into. So much, Rabbi Freedman, we'll come back. Coach Menachem, closing, and then let Rabbi Freedman wrap it up.
Yeah, first of all, thank you very much. And I do want to encourage all the questions people sent in. They should send an email to me, coachmenachem@gmail.com, or to Dr. Jacob Freedman, so we can continue with this discussion. So thank you for that.
Okay, Dr. Freedman, just leave us with a few words before you go, a little chizuk, and we'll wrap it up.
Yeah, I think that it's a tremendous zechus to be here with you because you guys are doers. And I think we heard from Mrs. Rosenfeld, who had an idea about helping people in the community. And now she has this organization that has scores of volunteers helping, I'm sure, well over 100 families. And this is saving lives because heaven forbid, as we discussed in the beginning, every community has lost a young individual to suicide. Every community has seen people hospitalized against their will. When we're out there supporting people, especially in a proactive way, we are changing the course of what's happening in the families within our community. And I'm grateful to be a part of this. What can I say? You guys are bringing on fantastic people, and in general, you're not promoting reckless psychedelic drug use, so that's good stuff. Not a dig at any individual, but I'm grateful. What can I say? When I know that you guys are on the same team with me, we got a lot of doers out there, and I think in Yirtzeh Hashem, we'll go to bed and we'll say we tried, and hopefully we should be successful. In the end, all we can do is our shtadlis, and it's up to the Eibishter to make it happen. So I'm wishing everybody a good yor, a shana toiva, and please, if I can ever be helpful, you just let me know.
Beautiful, Dr. Jacob. Thank you so much for giving us your time, and see everybody next week, same time, same place. For Rabbi Yossi Ben Shushan. Good night to everybody else, and to Dr. Freedman. Good morning.
Sei gesund.
Thank you.